CT scan, MRI, PET scan, mammography, blood test. Are you confused about what are the tests that are done to diagnose cancer? Let us dive deep into these topics in this video so that you can know about what all are the tests that are done for diagnosis of cancer. So watch till the end. I am Dr. Aravind. So let us know about the part 5 of the cancer awareness series video, where we are going to discuss about what are the methods of diagnosing cancer. So first thing, let us discuss about the blood test which is available. So the most common test which is available is complete blood count, which is usually done for literally everything. Whenever you go for any test, like complete blood count is usually done. So in complete blood count, you get information about the RBCs and the WBCs. When the RBCs are increased, then it shows you are having some kind of polycythemia. When it is decreased, then it shows some kind of dysfunction in your bone marrow, because of which your RBCs are decreased. And in WBC count, when it is increased, it might show leukemias, right? Leukemias or lymphomas and all these things. So apart from these, like there are general blood tests like liver function test and the renal function test, which might be deranged in diseases related to that, which are also not cancer specific, but it is definitely done as a part of evaluating for the cancer. So and the specific tests for blood tests for cancers are tumor markers, which means, like for example, if you have a ovarian tumor and we are not sure whether it is benign or malignant, then there are some things which is specifically secreted by the cancer cells into the blood. So these things are called as the tumor markers, which can be diagnosed with the help of the specific blood test. For example, CA125 is diagnostic. When the levels are higher, it is diagnostic of ovarian cancer, and when the PSA levels, prostate specific antigen, is levels are high, then it suggests the patient might probably be having a prostate cancer. But these are not definitive diagnosis. What is the definitive diagnosis, that will be discussed at the end. And also there are special blood tests available, which is like gene mutation genetic tests, like for example BRCA1 and 2 for breast cancers are also available, and some other DNA tests are also available. So and there are some things called liquid biopsies these days, where they detect the cancer cell from blood test itself, right? So that is not usually practiced, but it's there, all these things are available. So and imaging techniques, x-rays, usually in x-rays we are not diagnosing, it is not much useful, especially in the cancer cases, like especially for the diagnosis or detection of cancer. It might be, yeah, like some point, it might be pointing towards some abnormality, which might act as a screening test and further lead us towards doing some other tests like CT scan or MRI or something like that, right? So apart from that, ultrasound, it is done for breast, abdomen and pelvis, and if we detect any abnormalities, then that is not the definitive diagnosis. Then we go to scans like CT scan or MRI scan. So um, so in for most of the cancers, when we want soft tissue visualization much better, then the MRI is done. But in CT scan, for example, in oral cancer, CT scans are preferred. So these are some modalities for individual cancers. Whatever thing that is needed, it will be preferred. And PET scan, so CT scan and MRI scan, these are the scans for the specific parts of the body, like for example head and neck CT, chest CT, abdomen CT or something like that. But PET scan is always a whole body PET scan. It is mainly used so that to know whether, for example, if you did CT scan and if we found some cancer, like for example head of pancreas, we really want to know whether the tumor is just limited to that or it has spread to any other parts of the body. That's why we do a whole body PET scan, which shows whether there is any active lesion, any metastasis, any distant metastasis of the cancer into other parts of the body, so that it helps us in the guiding the treatment for the patient. So on mammography, it is a specific imaging modality which is developed only for the breast and breast related issues, for diagnosing breast related issues. Then the endoscopic procedures means putting a video camera in the natural orifices. For example, when you insert it into the anus, then and visualize the entire colonic area, then it is called as colonoscopy. When you put it in your mouth and try to visualize your esophagus, stomach, then it is called as the upper GI endoscopy. When you put into the airways and to visualize the airways in the lungs, then it is called as the bronchoscopy. When you put it into the urinary passage and try to visualize the urinary bladder, then it is called as the cystoscopy. All these things are used for cancer at the respective places. And for example, in cystoscopy, especially in cervical cancer, they would like to see whether there is any invasion and all these things. So all these things are done as a part of diagnosis, also as a part before starting any treatments also. And biopsy is the definite diagnosis. Whatever the things that might say, like you might have PET scan with cancer all over the body, you might have ultrasound, you might have CT scan suggestive of cancer and all these things, but nothing matters unless and until biopsy is proven. You are never diagnosed of cancer. That is very very important. So if it is in a superficial area like oral cavity, then that can be done with the incisional excisional biopsy. But when it is in deep seated area like abdominal cavity, then CT guided biopsies are done. And endoscopic biopsy, for example, when it is in the lungs, which is near the somewhere near the bronchus, then endoscopic bronchial ultrasound is also done to remove the tumor. Which kind of biopsy is also done in the similar way? For example, in colonoscopy, if you find a polyp in the colon, then you can do a biopsy through colonoscopy also. These endoscopic biopsies are also done. Apart from that, bone marrow biopsy is usually useful, especially in the cases of blood cancer, right? So after all these things, we will come to a thing called staging and the grading of the cancer, before which the treatments are. This shows like what is the current stage of the cancer, stage 1, 2, 3, 4, and which will guide us in the treatment. The main thing which you want to understand right now, we have understood about what are the tests that are available. That's fine, but what is the whole point in a general public being educated about this? What is the thing that you should know? See, first thing is like none of the things are like individually it is significant. It is a multidisciplinary approach. Suppose let's assume you have done in a MRA from primary hospital and it is suggestive of something, and then they did some biopsy and they refer to a higher center. But after in the higher center, they might not be satisfied with what are the reports that is given by the previous institute. They might ask you, get the CD of the CT or MRA which you have done, get the biopsy block for the biopsy examination again. So because this is a multidisciplinary team where pathologists, radiologists, nuclear physician, radiation oncologist, surgical oncologist, medical oncologist, palliative medicine people, ENT, gynecology, urology, and multiple other specialists are actually involved in the treatment of the cancer. Then they will review. So I am working in one of the largest central government hospitals in the entire India, which is the Safdarjung Hospital. So that, for example, even in AIMS Delhi, where I did my MD, which is the number one college in the entire India, these places have a specific waiting time for a MRI. For example, when they found something abnormal, they will ask you to get a MRA or sitting or something like that. For example, for MRA, it usually has some waiting period like 2 months, 3 months, and all these things. Then after that, if you are waiting for all these periods, for example, in the previous videos we have clearly discussed what is the importance of screening, because in India most of the cancers are diagnosed in the advanced stages like stage 3 and stage 4 cancers. So once you getting the symptom, which means like probably you might be in a higher stage, because most of the cancers at a early stage is asymptomatic. That's where the role of screening comes. So but after having some symptom also, if you delay in the diagnosis, if you delay in the starting of the treatment, by the time when it is stage 2 cancer, when you had symptom, it will become stage 3, stage 4 cancer before you start the treatment, which will definitely worsen the prognosis. By this time, it is the time is much money. See, for example, then you got MRA after 3 months, then suppose let us assume you had head of pancreas, so for which you have to take biopsy. Then again for biopsy, it is a deep seated biopsy. It has to be done with the help of some guidance like CT, so which will be done by interventional radiologist. Then again they will give you a slot, come after 10 days, 15 days, or 20 days. So after that you go to that day. Then after that histopathology reporting, anywhere the fastest reporting itself takes about 7 to 10 days. So by this way, then you go to the therapist like radiation oncologist or medical oncologist. By the time it will take like 6 to 6 months or more, 3 to 6 months or even more, or even 12 months. So if you make such delays, then by the time the cancer will be spread all over the body. So time is money. If you are in a private hospital, nothing to say. Right on the day one itself, they will do all the investigations, and right on the day two itself, they will start the therapy, because they also want money. They also don't want to lose the patient. So hence, and for example, biopsy might need to be first biopsy might not be proper. It might not be read to be repeated, and all these things. So many issues are always there. So and for example, first time you had some oral cancer, initially you are seeing ENT specialist, then they referred you to pathologist, then they referred you to radiologist for biopsy, then they referred you to radiation oncologist. So in this way, then after radiation oncologist, then they referred you to surgical oncologist. In this way, there might be so many people who might be dealing you. You might be having pain, then you go to pain and palliative medicine, then after that you might be reading concurrent chemotherapy and radiotherapy. So You might be, for example, if you had sugar, you went to a doctor, he treated you, he will be treating you for your lifetime. So there is no need for visiting other doctors. But cancer is not like that. It is a multidisciplinary therapy. So many doctors will be involved in your treatment. And for the diagnosis itself, it will take quite a long time. It is not like sugar where you get some blood test and the disease is diagnosed and the treatment is started next day. So this is going to take you a lot of time for the diagnosis, where you have to go to each and every department in the multiple hospitals. And apart from that, after diagnosis also, the treatment is also a quite lengthy process. So you should be ready before starting the treatment, before inducing the treatment. So that's what the role of right understanding comes into play, right? And for each and every patient, it is very individualized treatment. There is no standard protocol like if this much amount of, yes, there is definitely standard protocols, but means like the two patients having the same disease for the same therapy, they might not respond in the same way. So after the therapy, they might repeat a CT scan and then they will decide whether to go for proceeding chemotherapy or surgery or whatever it is like. So it is not like a custom ready-made shirt. It is like tailor fit for each and every person. Hence, cancer getting treated for cancer therapy, diagnosing, and all these things might be tiring for you, but it is very essential. So I hope this video was useful for you. If you had any doubts, please do leave it in comments. I will try to inculcate all those doubts in the upcoming videos and make those videos complete. And if you would like to hear about any specific topics also, please do leave it in comments. I hope this video was useful for you. I will see you in one another useful video like this. Until then, it's Dr. Aravind signing off. Om Shakti.